I just could not see myself taking care of complex chronic diseases that were mostly or entirely preventable.
eShadowing Session 3. Dr. Remington, how are you doing tonight?
I'm doing well. How are you, Ryan?
I'm excellent. I'm excited to chat with you again. This time talking about preventive medicine, something that I would bet you, and you probably have some better stats than I do, I'd bet you that 95% of the students here have no idea what preventive medicine is.
It might be a higher percentage.
I was being generous.
We'll go with the 95% confidence interval and say more than 95% of people, or fewer than 5% of people, have heard about preventive medicine.
Yeah. Before we jump in, I want to do a couple of housekeeping items just about eShadowing in general. So if you're watching this live here, 8 p.m. Eastern on Monday night, welcome. Thank you for being here live. If you're watching the replay of this, thanks for watching the replay. The replay is available through until about probably 10 Eastern every Sunday night. The platform that we're using will track your attendance both live and in replay form, and you can track your hours at eShadowing.com. You have to watch at least 45 minutes of this session and pass the test that we will give out afterward to get a credit for this, which you can earn a certificate with all of your hours and everything at the end of eShadowing. So with that said, also don't email me and say your hours aren't there, because they are there. You just didn't track them properly. The platform is working. Trust me, it's working for thousands of students. I'm excited to chat with you today, again, because of my experience in the Air Force as a flight surgeon. I was a preventive medicine physician, an occupational health physician, a little bit of do everything physician. Preventive medicine is one of those fields that is not well known enough, and is one of those fields that a lot of students going into medicine want to be the ones that impact their community on a big scale. And preventive medicine is one of those fields that they can do that. So I'm excited to chat with you and expose lots of students to preventive medicine. What is your elevator pitch for what the heck preventive medicine is when students are very confused?
Well, I would say that preventive medicine is the someone when a clinician is sitting in a room with a patient confronted by an illness that is entirely preventable or largely preventable, like obesity, like lung cancer, like COVID-19, and they're taking care of the patient, but they think to themselves, someone should really work in the community to make sure this doesn't happen again. And you hear that a lot, that refrain that I wish somebody would do something about this, but my job is working downstream, taking care of sick patients or patients with complex chronic illness. Somebody really ought to be doing something. I don't have time. I don't have the expertise, but that someone is really preventive medicine. Preventive medicine is working upstream, the river metaphor, where people are sick and floating down the river and having to be pulled out and resuscitated, and that someone is upstream trying to figure out how to keep them from falling in the river. So that basically it's public health. It's the practice of public health by a physician. And there's a subspecialty called public health and preventive medicine, where we focus on the what we call the competencies in public health.
Yeah, it's funny. I love that upstream analogy. I just finished a book a few weeks ago, if not a couple months ago at this point, called Upstream. And I didn't know when I read the book that it was mostly based on healthcare and the whole upstream effect of preventive medicine, preventive healthcare, preventive programs. And exactly what you mentioned, pulling people out of the stream. The book opens up with this story of the two people at the stream, and there's a kid floating down the river screaming for help, and they go and rush and save the kid, and then there's another one, and they go and rush and save the kid, and then there's another one, and another one, another one. And finally, one person starts walking off, and the other guy's like, hey, where are you going? He's like, I'm going upstream to stop the guy from throwing the kids in the river. So it was a great analogy, and again, I'm excited to dive in deeper with you. And the book again is called Upstream, for those asking. Yes, Dan Heath. Look, some people know what this book is. Cool. At a kind of a 30,000 foot view, what does a preventive medicine physician do day in and day out, right? I think a lot of people, especially pre-meds who are watching this, know Grey's Anatomy. They know House. They know ER. They know all of the TV shows that glorify what medicine is. Is preventive medicine anything like that?
You're working upstream, so you tend not, the person you keep from falling in the river probably never says thank you. You didn't save their life. They don't know that there's maybe even a river there because you built a fence or a bridge with safety rails. So we've heard about the thankless sort of the Rodney Dangerfield profession of preventive medicine is we don't get no respect. Because you don't really get thanked for a death you prevent, a case of lung cancer that never happens because of a policy that restricted smoking in indoor places, or the COVID case that never happened because you worked hard to get people to wear masks and socially distance. But if you were in the ICU and you pulled a person through a terrible event, they'll thank you for the rest of their life. So yeah, I think in some respects, it's not like these shows because that wouldn't make a very good television show. There is a movie called Outbreak, which is about an epidemic. I mean, I think the probably now, particularly with COVID-19, the most familiar part of our job would be people who do public health. At the governmental level, at the local, state, or federal level. Probably the most visible person doing public health is Tony Fauci, who is, although he's not formally trained in preventive medicine, he's doing preventive medicine. He's communicating information about the evidence, and he's communicating to an audience. He's not sitting in front of a patient working at the bedside. He is working with the entire nation to try and help the nation be healthy. And so people at CDC many of them are trained in preventive medicine. I worked there for 6 years. I did my preventive medicine residency at the CDC. So that's a very long-standing place for physicians to work. And if I was working at CDC, I'd be definitely working on COVID-19 right now. There's almost no way to avoid that. All the other public health problems are still there, but all the time and energy and talent at CDC is focused on COVID-19. But I also worked for 10 years, almost 10 years at the state health department, and I did chronic disease prevention. So a typical day for me at the state health department was working on cigarette smoking prevention. So we got a grant from the National Cancer Institute, and we had to figure out how to reduce the cigarette smoking rate over 7 years in Wisconsin by about 40%. That's what they gave us, $7 million in a contract. And they said, Dr. Remington, your job is to cut the smoking rate by 40%. And how do you do that? $7 million, about $1 million a year was a lot, but it pales in comparison to what we spend treating the problems related to cigarette smoking and smoking related diseases. So we set out to pull people together in communities. So I visited many communities. We formed a tobacco-free Wisconsin coalition of health organizations and voluntary organizations and physicians and health professionals. And then we said, well, we need these coalitions at the local level. That's where action happens. That's where local ordinances are passed. That's where youth programs are developed. That's where patients go to see doctors to help quit smoking. And so we probably had 40 or 50 local tobacco-free Wisconsin coalitions. And then the most important tool in our black bag is not medicine delivered at the bedside, but is it's the laws, the policies, the rules that help structure the environment, the community environment, so that people can live healthy lives. And with smoking, one of the most important things was to limit where people could smoke. When I was a kid, both my parents smoked in my home. My dad eventually died from lung cancer, so that had a personal impact on me. And then you could smoke in college, in dormitories. People could smoke in movie theaters and everywhere, basically, even on airplanes. Even though there was a smoking section, the minute the no smoking sign went off, the airplane filled with smoke. Anybody who remembers those days. And so our job was to figure out how to structure communities so that we limited where people could smoke, if for no other reason to protect non-smokers' health. So that was a lot of work. Community, working with elected officials, figuring out how to get restaurants to voluntarily go smoke-free. And a lot of my experience in working in tobacco control has really parallels to today. In fact, just last Friday, I was on Wisconsin Public Television talking about the fact that the use of a mask is really primarily intended to protect others in case you're sick and don't know it. And the analogy is, you wouldn't want to go into a restaurant today and have somebody smoke, because it's going to harm you. You can smell it, it burns your eyes and your throat. And so people don't smoke in restaurants, not because it's sort of bad for them. They're smokers, they can take it outside. They don't smoke because it's harmful for others. And the mask analogy is, please put a mask on. And, it's like putting out the cigarette. Put a mask on to protect my health. And that is not well understood in society today. So a lot of my work is trying to get people to understand, first of all, that masks are effective. They're not perfectly effective. They don't eliminate all virus from a person who's ill, but they take out a considerable amount of the virus and trap it in the mask. And it reduces the risk maybe by half of spreading the virus. So that's a big job, turns out. College students come back to campus, some of whom basically, behave as if there is no COVID-19. In fact, they might actually be out seeking infection to get it over with. So anything that is done, and I like the metaphor of working upstream, anything that's done not at the patient bedside, but in the community, that someone who should do something about it. We're trying to keep people well, we're trying to keep people healthy, active, and out of the doctor's office, and certainly out of the emergency room in the hospital. And a lot of that involves public education. It does involve health policy and law and engineering and all of the things that make a healthy lifestyle. We have an expression where we make the healthy choice the easy choice. So the healthy choice should be easier because you structure choices so that it's easy to eat a healthy food as opposed to an unhealthy food. It's easy not to smoke because there's a law that says you can't smoke. We do have some laws that say you shouldn't drink and drive or text on your cell phone. And those are more enforcement oriented because it's bad for you, but it's really bad for the person you kill, the innocent person who's a pedestrian or a passenger in another car. So again, my work is largely, well, I used to do more epidemiology, studying these problems and using the data to convince people smoking is a problem. 7,500 or 8,000 people die in Wisconsin each year. We used to just put out paper after paper saying, look at the burden of tobacco. So something must be done. And then we pivoted to look and say, well, these programs, raising the cigarette excise tax, limiting advertisement, keeping kids under 18 from buying cigarettes, banning smoking in indoor environments, providing low or no cost smoking cessation. These things, with that, we could drop smoking rates in half and save not, a life, but maybe 100,000, 200, 300,000 lives a year if we did that in this country.
When you talk about that kind of stuff, right, smoking cessation, it sounds like the burden is just so gigantic because you're fighting big tobacco, right? You're fighting the companies that are making billions and billions and billions of dollars, and they don't really care about the downstream effects. When you're talking about trying to get people to wear their masks. You're fighting against this American ideal of individual freedoms and people saying that you can't tell them what to do. How frustrating is a lot of what you're doing day in and day out as a preventive medicine specialist, because you're fighting capitalism, you're fighting our independent nature as Americans, and just so many other issues?
Well, that's a great question. I think it is hard. I think there's two areas in preventive medicine. And if anybody's interested in preventive medicine, you ought to think about whether you're more interested in health protection. In other words, protecting people from harms that come to them in the environment. Infectious disease. There isn't a person, I think, in this country who wants, tainted food. Or bad water. So if you think about the health protection part of public health, I think there's tremendous support. Yes, you're battling the industry. You're battling the industries that pollute rivers. You're battling industries that want to produce food quickly and maybe do so by contaminating the food supply. But I think most industries would say that we'd rather not have E. coli 0157 in our hamburger meat. So we're going to do everything we can to make the food supply and our water and our air safe. Again, there are industries that really don't care about air quality and climate change, but I think that whole field, you've got people saying, yes, protect my health. I want to be safe. My path was, I worked for 2 years in infectious disease epidemiology, and that interested me. But when I looked at the deaths in this country, and I started thinking about, where is most of the suffering? My, grandparents died from cancer, leukemia, and stomach cancer. And I kept thinking to myself, what are the major public health problems? And I discovered that they're not infectious diseases, even though COVID-19 is now becoming a leading cause of death. They are the deaths that result from our own human behaviors: smoking, not exercising, not eating right, abusing alcohol, and unsafe sex and other behaviors. And so when I started working at the CDC, there was a survey that was just beginning. It was called the Behavioral Risk Factor Survey or Surveillance System. And I started working on that. And the system is nationwide. If you've ever seen, I'm sure pre-med students or medical students have seen the maps of obesity in the nation as each state increased. The states go from all blue and green to red and orange. Well, those data come from the behavioral risk factor surveillance system. So I became more interested in health promotion. So in a way, my job is even more challenging than protecting people, because most people say, okay, regulate restaurants, regulate the water, and let's fight the industry to protect people. But my job is protecting people from themselves.
Yeah.
And so people view a lot of our policies as paternalistic. I'm telling you to buckle your seatbelt because it's good for you, and you should know that by now. Well, maybe you decide not to. Well, then I'm going to pass a law, and it's not just going to be a law if you get pulled over for something else. We're going to have a primary enforcement law. If a police officer sees you without a seatbelt, they can pull you over and give you a ticket. And people hate that because that is, I'm sorry, I'm an adult. I understand the risks. I want the freedom to just drive without a seatbelt. Or a better example maybe is a motorcycle helmet law.
Yeah.
I think we should have a law that should require people to wear motorcycle helmets to protect them from themselves. But very few states do. Wisconsin had one for about a year and it was repealed years ago. That's a classic example of the individual saying, I know it's dangerous, but I don't want, my nanny state telling me what to do. So I am going to choose to, ride a motorcycle or a bike without a helmet. I'm going to smoke cigarettes if I want to. They're legal. and I'm going to not wear my seatbelt. And you can go all the way down the list, all the health behaviors, the health risks that people take. And so my job's a little harder in that we have to think about ways to provide incentives to people to make the healthy choice. So with seatbelts, you make it fashionable. You start young with kids. You have films that show, people getting in cars, and you just make it normative at an early age. You also market safety. You make it desirable by making it something that people want. And so it's a 2-decade project or more to try and get seatbelts to be normative so that people, do the smart thing and protect themselves. So it is hard. I mean, I have heard preventive medicine physicians say that we don't get the same, rewards from patients saying thank you, or that we are fighting, some pretty formidable opponents. I was on the tobacco industry's, I wouldn't say hit list, but
my grandmother used to call it the S list for SHIT. I was on the
well,
S list.
if you Google my name, you can find me in industry documents. You can find, they were very interested in the work that I was doing. They wanted to catch me crossing the line as a state employee. They wanted to. A colleague of mine in Colorado was sued by the industry for crossing the line, for lobbying and influencing legislatures, which is not permitted. So that was very hard. And then probably my most sort of notable confrontation was I wrote a paper on trends in obesity in Wisconsin back in about 1990. We became the #1 state in the rate of obesity. And so I wrote a paper. I put a map in it, and we put a press release out saying that Wisconsin had become the state with the highest rate of obesity. Well, I was quoted as saying that perhaps it's the beer, butter, and bratwurst in the Wisconsin diet that was responsible. And this got picked up by the Associated Press. And I remember the day like it was yesterday. It was April of 1990. I was in a hotel at a cancer conference, and my secretary called. We didn't have cell phones, by the way, so called the hotel. Someone came up and said, "Dr. Remington, you have 85 phone messages." Newspapers and radio stations are calling from around the country. They want to talk to you. And I went back, and there were pink slips, phone messages this thick, and it was a nationwide story that, and people made a lot of fun of Wisconsin for being, the fattest state in the nation, and lots of headlines. Well, the next day, the American Dairy Council, Wisconsin's a dairy state, basically released a press release about me, saying that my study was, flawed, that blaming, milk and dairy products was inappropriate. There's no evidence, blah, blah, blah. And
anything to discredit you.
Anything to discredit me. And then my boss basically said, "Well, Remington, for a while, you're not going to be talking to the press." So that is a frustrating thing. But, my view is if we don't do it, physicians are in a unique role, I think, in a unique position to be influential. And I try to tell people, I once went up to a discussion with somebody about tobacco, and they were arguing with me that this project was overreached. And I said, "Look, I'm here as a volunteer. I'm not getting paid to be up here tonight." I said, "You are," and the industry was paying him. I said, so I'm motivated by public health and to save lives. And that's why I'm here. And that really helped turn that debate because he was an industry shill, and and was being paid to debate that, in fact, environmental tobacco smoke wasn't as bad as we all thought it is. And so it is frustrating, but it sort of gets you up in the morning, and you try and do the best job you can.
Well, let's talk about. You mentioned Dr. Fauci. Obviously, he's in the public eye right now because of COVID-19. You'd mentioned yourself in the public eye, at least in specific industries, and making news based on different things that you're writing about, that you're studying. Does someone who potentially is interested in preventive medicine, do they need to be okay with having that much scrutiny on themselves from a bigger picture? Because the majority of physicians are just patient to patient to patient to patient and don't really have that bigger impact on the rest of either their community or the country or the world. Do you have to want to be in that situation to be okay going down this path?
Well, it's a great question, Ryan. I think, first of all, preventive medicine is sort of like all of medicine. And you say, well, what do you do as a physician? And, if you say you're a radiologist, somebody thinks they know what you do. There are so many different kinds of radiologists, right? There's a pediatric radiologist, neuroradiologist, intensive radiologist, or interventional radiology. So you say, I want to be in radiology. You haven't really said what exactly you're going to be doing. And that goes on and on. Internal medicine isn't really just internal medicine. It's a variety of specialties. So I think there's as much diversity within the field of preventive medicine. The traditional governmental public health is what many people think of, working in government. But you described occupational medicine. So some physicians would rather be in charge of an entire population. Let's say the Air Force. That's a captive population in a way. I mean, you're captive for your tour of duty, and for some people that turns out to be their entire 20-year career. And so somebody's got to take care of you, soup to nuts, as my mom would say. Your safety on the battlefield, but also your health, physical health, mental health, substance abuse, all of the things. So who's going to do that? You're not just going to have a physician, at the clinic take care of the entire military. So preventive medicine in the military is a robust field. So many people we have a preventive medicine resident who came from the military. He got his medical school paid for, did an internship, and then now he's doing preventive medicine. He was 5 years as a flight surgeon in the Army, I believe. Or Air Force, sorry. So I think there's a lot of diversity. Now, there is a field of preventive medicine that is more like lifestyle medicine. It actually involves clinical care. And so it's not what I do. I'm involved outside of the clinic in the community or working on policy. But there are many preventive medicine physicians who do lifestyle medicine. And that is trying not to take care of sick people, but trying to work with people to keep them healthy. So that's one area. The other big area is health systems now are being asked to be part of the solution and not just part of the cure. And so health systems have to be accountable for the health of their patients. And this is all of a sudden pretty new stuff, because not only do they just have to take a patient in, fix them up, give them a medicine, send them on their way, they have to make sure that they don't come back in 30 days. They have to make sure, in fact, that they're as healthy as they can be to lower the costs, to improve population health outcomes. And so preventive medicine is now, physicians are being tapped in health systems to make the health system as healthy as it can be. What are the rules, the reimbursement rates, the outreach, the nurse partnership programs, all of those things that we can do to make the health system more effective. I don't work within the healthcare system. My work is, more right now, it's more as a teacher, as an academic. But when I worked for 15 years in public health, it was in governmental public health. But I would say, if you're interested in working at the bedside, but you're interested in that conversation being, how do we stay healthy? How do we work on lifestyle and exercise? Then that is a field called lifestyle medicine. And many physicians in preventive medicine do clinical work. It's required in our residency program, only 2 months a year, and typically no call. So it's not, I wouldn't call it a clinical training program, but it's not without some clinical experience as a requirement.
Why is there a field of preventive medicine? Why not just have a preventive aspect of every field?
Well, that's a great question. Another great question. We, as a profession, I'm a member of the American College of Preventive Medicine. We have been sort of talking about that very topic. Why don't we just put prevention on everybody's agenda, and then our job will be done? I think we could make a very good argument for that in the clinical setting. Because I would argue that those physicians in preventive medicine who are doing lifestyle medicine, family medicine, pediatrics, internal medicine should all be doing that. And I think as reimbursement mechanisms are changing so that they're bundled payments and they're pay for performance and all these words that maybe you haven't heard about yet if you're a pre-med, but you will hear about in medical school. And if you don't hear about it in medical school, you'll learn about it in clinical practice. This is how medicine is changing. So all of the initiatives within the health system are trying to get physicians to be more like preventive medicine doctors. So I think there's a good argument that prevention should be on everybody's agenda. That's not occupational medicine, where physicians work in industry or for large populations like the military, and certainly governmental public health. That's an area where people with clinical training really don't come in with the skill set to know how to do a prevention program or run a outbreak investigation. So that I tell a story about training medical students. So I've been in public health for 15 years, 6 years at CDC, 9 years at the State Health Department. I had amazing friends and colleagues, really visionary leaders at CDC. And so I came to the medical school to start a course, and it was called Physicians in Public Health. And I brought in my colleagues who were outstanding public health physicians. And, the medical students, nobody started signing up for it. And then I offered free pizza and I got a few people to come. And I think at best they listened, politely. And then one day I invited a physician in who's a busy family medicine doctor, but she also did global health and community-oriented primary care. And she was amazing. And the room filled up because what medical students want to do, and I'm teaching a course now with about 80 medical students, an elective in our first year medical students. I now teach how to do medicine and public health, because I don't think coming into medical school, I certainly didn't come into medical school and say, I want to be Anthony Fauci, or I want to be, the head of CDC. I came in saying, I want to be a doctor. I want to take care of sick people. I want to, be able to treat people who are sick. But medical students coming in today are saying, I want to do that. I want to be a, great doc. But I also want to make a difference in my community. I want to advocate for broader public health issues. And so we talk about how you can do that, how you can be an outstanding physician, but also carve out a part of your job where you're leading a reach out and read program, a health literacy program for kids. So you're seeing kids 3-4 days a week, but you've carved out time to develop a health literacy program so that kids achieve readiness by the time they get to school. Because if they don't do that, they're going to be in your pediatric clinic and in the adult medicine clinic down the road with real health problems if they don't know how to read and they don't know how to get a job and they turn to substances to treat the pain. That is a cascade of events that can be prevented. And some physicians now have carved out that part of their career where they say, I want to be both a clinician, but also be an advocate for healthy kids.
Let's run through a scenario where a preventive medicine physician like yourself may be called in for something, whether it's and you can choose one or come up with something that you have some knowledge around. The things that come into my mind are the Flint water crisis, is as one big thing. Something that comes up every so often are salmonella outbreaks with lettuce or something like that. Talk about how preventive medicine and outbreak kind of, I can't think of the term, tracing, how that plays into preventive medicine. What a student who may love being the Sherlock Holmes may potentially love preventive medicine in that way.
Well, that's a great term, the Sherlock Holmes. Well, we don't have to go very far. COVID-19 is the best example. So right now, we need clinicians to take care of people who develop respiratory illness severe enough to require medical attention, hospitalization, ventilator, potentially life-saving interventions. So we need pulmonologists, we need internists, we need, respiratory therapists, we need outstanding clinicians to be really good diagnosticians, and then treatment, and then we need, people who are really doing good research on long-term effects and how to, first of all, study to see what those are, and then determine how best to prevent the sequelae. But when you see a person in your office, and let's just say they're a 20-year-old college kid who has lost their sense of taste or smell, and they have a little bit of sniffles, and you do a rapid test, or let's say you do PCR, and you discover they have COVID-19. Well, your job as a clinician is to make sure they don't get sick, right? Is to have them monitored closely. But basically, your job kind of ends when they walk out of your office. That's when public health kicks in. There's an army, more than 1,000 in our state, an army of contact tracers who are going to take over at that point. They're going to say, okay, to the person who's infected, you have to go into isolation. We hope you do so voluntarily. There are laws that could force you to do that, but there's no way with, in our state, we have, 3,000 cases diagnosed every day. So there's no way we're going to be forcing anybody to go into isolation. But we give them guidance about what it means to be in isolation. And then we have to do contact tracing, because what you want to do is interrupt transmission. Find those people who had a significant exposure, 15 minutes or more in close proximity in an indoor space, and then put them into quarantine. And so that whole operation that happens after a physician sees a patient is run by public health. So for a while, I began every day at 8 a.m. on a Zoom call with the leading physicians in the state of Wisconsin, who were setting out strategy for that day, how to deal with a statewide pandemic, with ensuring we had intensive care beds, but then running really the system to make sure that you could get ahead of the virus. And so I think if somebody says, I'm interested in being the Sherlock Holmes, I'm interested in doing what our residents are doing. One resident, one of our prisons in the state, has had a significant outbreak. Well, we don't really understand why. We don't understand how it got into the prison. We don't understand how it's been spread. We don't know a lot about this virus. So that provides an opportunity to do an epidemic investigation, where you go and you talk to absolutely everybody, all the prisoners, all the staff, and visitors, and you ask a series of detailed questions. And now you have to do an epidemiologic investigation. What were the factors that led some prisoners and some staff to get sick? Even doing genetic testing and finding out, were there more than one strain of the virus, or were there multiple cases? So that's a kind of sleuthing or epidemic investigation. And then the other question is, a physician, really a clinician, hopes that their patients are being safe, but a public health physician has actually got to figure out how you get people to understand the role of safe distancing, the role of staying outdoors if possible, of mask use. So they're in charge of messaging campaigns. Was it this morning? Yes, this morning I was on a call where we talked about social messaging, not the state health department, full page guidelines, but how do we get to the 20-somethings or to the teenagers with a message that resonates to them?
Memes. It's all about the memes.
Well, so how you do it is you get 20-year-olds involved in the messaging. So that's what I would say is this pandemic is not going to be solved at the bedside in the ICUs. It's going to be solved by figuring out the epidemiology of COVID-19, which is still evolving, our understanding of it, but it's going to be evolved. It's going to be addressed by sort of basic public health practices. And I think a lot of people starting their careers, physicians in particular, will be sort of captivated by this work that happens outside in the community. It is as you can imagine, it is incredibly complex. This is not sort of like, working in ICU is incredibly hard and complicated and taxing. But being in charge of the state and, working within the administration, working for the governor and trying to prevent deaths, trying to make sure that we don't, have hospitals that are overflowing. I can tell you, that's not my job. I direct a residency program and my residents are boots on the ground. But the people in charge of this program, I can tell you, many sleepless nights, really a difficult job to try and figure out how to stay ahead of COVID-19. So that Wisconsin, was in the top 2 or 3, probably still his second highest incidence rate. We're seeing hospitals that are nearing soon to exceed capacity, and we just have to figure this out.
Yeah. Was shocking Wisconsin, their state Supreme Court overturned the public health orders that shut everything down because they're like, we're good. And then it's not. But we'll leave Wisconsin alone for right now. Talk about the kind of nuts and bolts training to be a preventive medicine physician. Do you just go to any residency you want and just proclaim at the end, I want to be a preventive medicine physician, or what's the specific path to get there?
That's a great question. So it has to do with, so preventive medicine is one of the American Board of Medical Specialties, ABMS specialties. And as such, the ACGME has requirements for competencies. So when you train in preventive medicine, you have to accomplish all of these competencies. You have to take boards to become board certified. It requires an academic degree, like a Master of Public Health. So that's required in our program. We provide that at no cost to the residents. So actually, in 1 year of your residency, you're doing graduate school, graduate studies, focusing on all the core competencies of public health, epidemiology, and biostats, but also social behavioral sciences and communications and ethics and health policy. So you're really learning all that, part of the black bag of working upstream. And so that's the academic requirement. And then the practicum requirement is to actually go out in the field and do work on quality improvement in a health system, or go and work up an outbreak investigation. In fact, you're supposed to, when you're in our program, work up an outbreak investigation. And we used to have, times when 2 years would go by and a resident wouldn't have an opportunity. So they'd have to go through a mock outbreak investigation. Well, I can tell you our residents arrived July 1, and within days they were working on outbreak investigations. So that those are sort of the basic core competencies. There is clinical work required. It's often prevention focused. So we have our residents working with young adults in a student health clinic, working on risk reduction and healthy lifestyles in college. So I would say that the key the key attribute in preventive medicine is problem solving. It is seeing a problem and trying to figure out how to address that with many different moving parts. So how do you address an issue and understand the role of the industry? How do you understand the role of government? There are nonprofits, there's a healthcare system, there's advocates. So I think an attribute that is really important in preventive medicine is being able to really work with multiple partners, particularly the importance of working on health disparities and disparate populations. We know the effects of racism and situations of poverty in our urban centers, and similar problems in rural areas. And so how do we work with those communities and work together on solutions? So it really is, I like to think about it as if you're a pre-med and you've volunteered in a clinic, homeless shelter, done some service. I always think about it not as to what do those people need right now, is what did they need that didn't go right? And how can we help assure that the next person who's about to become homeless doesn't become homeless? And so to me, it is problem solving. It's focused on prevention and thinking about working with a lot of different partners, outside. You have to not only think outside the box, you have to work outside the box.
What are some good resources for students to start learning about how our government, at least here in the U.S., for those watching in the U.S., how our government works, both on a local level and a national level, to start seeing if they're even interested in that, right? We, I think, as a population, at least from the media side, we see politics as this very divisive, very contentious thing. But at a local level, at least, politics can be very interesting and be very impactful on the community. How can students start to learn about how all of that works and start to explore if they're interested in that?
Another great question. I would say get involved. When I was a fourth-year medical student, I was interested in global health. My brothers had been in the Peace Corps. Two of my brothers, two had gone to Vietnam. The horizon to me was sort of outside Wisconsin, outside the U.S. And so I wanted to do a global health elective, and it was all set up, ready to go in Kinshasa, Zaire. And there was a civil disturbance, and they canceled it. And at the last minute, as you might imagine, I was desperate for an elective because I wanted to graduate from medical school. So I had a friend who worked at the health department, and I went uptown to our capital, and I was captivated. I worked on 2 outbreak investigations, a case of typhoid fever in a community that had been imported, which had spread within the community, and also an unusual fungal infection in people making decorations for graves in the winter. These pine needles injected spores of Sporotrichium schenkii, which lives in sphagnum moss in the central bogs of Wisconsin. Who knew?
Of course, I knew that.
But it leads to this nodular lymphadenopathy that goes up the arm and into the armpit. And so it was called sporotrichosis. I investigated the outbreak. It was fascinating. I felt like Sherlock Holmes because I found the people who wore gloves and the people who didn't, of course, not wearing gloves was a risk factor. I found the contaminated batch. We cultured Sporotrichium out of it. And then I did a case review of all the cases reported to the lab over the last 10 years. I did this in 1 month. I felt like I was, discovering something. So to me, if a pre-med or a medical student wants to get involved, is call your local health department, call your state health department, and look for shadowing opportunities. Again, with COVID, one thing, if you wanted to be a contact tracer, I know many, I teach a large undergraduate course at the university. We have 300 to 400 students. It's a introductory course in public health, and many of the students were contact tracers, so both on campus and in the community. So I think just get out and get involved and look for people who would be able to talk to you about that kind of work. It doesn't have to be a physician, because much of public health is done by pretty diverse teams. But I do think if you're thinking about medical school and you're interested in what a physician, maybe a career at CDC, I mean, I think once I figured out that I was interested in public health, while I was in medical school, I applied to the Epidemic Intelligence Service. That to me seemed like sort of the pinnacle of training, and I was fortunate to be accepted during my internship. So my training path sort of took a sharp turn to CDC, and then I took advantage of that Epidemic Intelligence Service 2-year epidemiology fellowship, and then their preventive medicine residence, and then I did a career development program. And sort of, if you're interested in working at CDC, that is definitely a career path that I would endorse. It's an exciting, amazing place, but that's not the. I mean, I don't want to make the impression that that's the only career in preventive medicine. There are many other opportunities.
Why, before we end here in a minute, I just want one plug, because I don't think I've seen one person say it right. It's preventive medicine, not preventative medicine. So I always, that's one of my pet peeves. Why is preventive medicine such an outlier in terms of exposure for students?
Well, great question. I think there are a number of reasons. First, when you're focused on prevention, you're not a revenue-generating department. So many medical schools look at preventive medicine departments and say they're the money takers and not the money makers. So when schools of public health grew up and differentiated from medical schools, oftentimes preventive medicine physicians and their epidemiology colleagues went to the School of Public Health. So sometimes you might have a medical school where the School of Public Health and preventive medicine is across town, or maybe it's not even on the campus because it's in another university. So there are very few role models. It doesn't fit the modern academic medicine sort of niche of acute care, tertiary care hospital. So that's where a lot of medical students learn, is in tertiary care hospitals. It's not primary care either. So it's an important mission in medical schools is to train the next generation of primary care providers. So I think you don't see too many preventive medicine mentors. I was fortunate, but I had to leave the medical school to work with a mentor who was working in public health. And I think this prevention is not as glamorous as treatment and cure. It certainly doesn't fit the model of why people go into medicine. I think people pre-med are interested in making sure that everybody lives a long and healthy life, and health equity, and social justice. But when you get into medical school, the real model is taking care of sick people, getting compensated richly to do that, and then doing research largely financed by NIH or pharmaceutical companies that focus on treatment and cure. And at the end of somebody's life, if they're going to write a big check to a medical school, they're not going to write it because somebody, Dr. Remington kept them healthy till the bitter end. They're going to write it because somebody saved their life. And so I think you have to seek out preventive medicine. It won't be, right there front and center when you're on your first day in medical school.
It seems like it's very similar to vaccines, where their success are kind of their downfall, because if someone is good at preventive medicine, at changing policies, it's transparent to the community, to patients, because it's just, you don't know about it because it didn't happen, right? It's much sexier for a physician to fix a broken bone or to bring someone back to life after a heart attack versus policies that were enacted 15 or 20 years ago that prevented a broken bone or prevented a heart attack. And so it's kind of hard to get people to go, look, it's not as sexy, but your impact, and this is why I always talk about preventive medicine is such a sleeper specialty. Your impact on a broader level, on a community level, on a national level, on a worldwide level is just exponentially, the potential is exponentially bigger than anything else you can do as a physician.
Well, I first of all, you are unique in that perspective, particularly somebody working with pre-med students, because when we have applicants to our preventive medicine residency program, my first question is, well, after, nice to meet you, and, where'd you go to medical school, is how'd you hear about preventive medicine? And almost to a person, they say, well, it was just by total accident. I was doing this rotation, and this person came in and said, have you thought of preventive medicine? Nobody comes to me and says, as an undergrad, I wanted to be like Tony Fauci, and I wanted to be a leader in my community and work on health policies that, kept our communities healthy. I'm sure there are those people, but they probably go to other residency training programs. So we largely get people who get into a clinical residency program and who either during that clinical training program or after it say, I need something more or something different. Training in psychiatry saying, this is not the root cause of these individuals' problems. I can't see myself prescribing medicine. In fact, we had 2 people step out of a psychiatry residency because they just didn't see themselves following the mode of a patient comes in, diagnose, and prescribe a medicine. Next patient comes in, diagnose, prescribe a medicine. Next patient comes in, you tweak the medicine. And they said, that is not the source of the mental health problems, substance abuse problems we're seeing. I want to work on the solutions that keep people from having mental illness. And so, and that happens over and over again when people get into clinical training programs. It happened to me during my internship. I just could not see myself taking care of complex chronic diseases that were mostly or entirely preventable. I remember taking care of a surgeon dying from lung cancer, a heavy smoker, in fact, continued to smoke on the ward. And I was the intern who had to drain his chest fluid. And can you imagine, this is a renowned surgeon, and I'm an intern, and I have to put a tube into his chest. And he was so angry at me. And I literally said, I don't understand it. Why are you angry at me? I mean, I'm not the one who smoked cigarettes and got lung cancer. You should be, mad at yourself. And then I realized I don't have one clue of what smoking is and why people smoke with lung cancer. I was very naive and said, well, if smoking is dangerous, don't smoke.
Don't do it.
And
it's that easy.
Yeah, it's that easy. So that experience taught me that I just didn't see myself being able to walk in, day out, putting chest tubes into people who had, pleural effusions from metastatic lung cancer. I am thankful that there are really competent physicians who took care of my dad and very sick people and help them along their journey. We need that. So please, if you're training to be a competent physician who is excellent at diagnosing and treatment, we need you. But if that isn't what gets you up in the morning, we need people who are thinking about prevention. That someone who can take care of things when clinicians get very frustrated by seeing the same thing over and over again. Preventable illness that doesn't need to be in the hospital and being, getting oftentimes too little care too late.
Well, Dr. Remington, I want to respect your time. I want to thank you for taking the time tonight to chat with everyone, and hopefully we can make preventive medicine sexy again, if it ever was sexy. But we'll make it sexy so that more and more students seek it out and don't need to randomly stumble upon it at some point.
Well, if there is a silver lining, there are some benefits to COVID-19, a few. One of them is I don't think anybody is going to wonder what the CDC stands for or what epidemiology and quarantine and isolation are. It's right in front of us. And so if that interests you, not simply the care of patients ill with COVID-19, but understanding the systems, how the healthcare system and our governmental public health systems and the global health system is dealing with COVID-19, then public health, preventive medicine is a specialty that you should take a look at.